have with us today Dr. Adam Keach, a board-certified prosthodontist who practices with Dr. Ann Nicholas at the Palm Desert Center for Advanced Periodontics, Cosmetic, and Implant Dentistry. What is your role at the Palm Desert Center?
So I'm a prosthodontist.
Okay.
And that means that I've gone through 3 additional years of training beyond dental school, studying crowns, bridges, dentures, implant, and aesthetic dentistry. So my role at the practice is I work with Dr. Nicholas, and we provide 2 specialties under one roof.
Dr. Nicholas says you make the teeth look real. Can you walk us through what real means?
Well, it's, any dentist can make a tooth, but to really make a tooth that mimics a natural tooth, you got to spend a little extra time noting the little characteristics and the details within that tooth and communicating that information to the dental lab, the ceramist. And we do that through digital photography. Sometimes I even will take the patient over to the dental lab so that the ceramist can take a look at the patient's shade and the characteristics of their teeth to be able to mimic that with the final restorations.
She says you are changing people's lives. Is this true?
I think we change lives every day. I think if it's a patient who is missing a single tooth that is being replaced by an implant, or if it's a patient that has lost all of their teeth and we're replacing all their teeth with a prosthesis or with dental implants, the change is immediate. The functional difference is significant. And so the patient immediately is able to function better, is able to present themselves better, and the quality of life is improved.
Are dental implant patients the happiest patients?
I definitely think they're the happiest. If you can imagine trying to chew with dentures, loose dentures in your mouth, something that moves around, attempting to eat the foods that you enjoy the most is extremely difficult. When you're able to solve that problem for them with the placement of dental implants to secure those dentures, then the impact is immediate. And I can't think of any other treatment in medicine where the difference is such a significant change for them.
Do patients tell you they wish they would have done this like years ago?
They definitely do. I mean, when they can feel that difference, they wish they could have done it 20 years ago.
What's new in your field in restoration?
There's lots of new technology over the past 15, 20 years that has moved along with dental implants. The one thing is that the dental implant technology has improved. So the surface of the implant has changed, which allows the implant to heal into the bone quicker than it used to. So that means reduced healing time for the patient. It also means that sometimes, depending on the case, we can immediately restore the implants at the day of surgery, which also is more comfortable for the patient because they no longer have to wear a removable denture. There's other technologies where some of the final restorations that I'm designing can be made by a computer, and it's manufactured digitally. There's a lot of exciting things in dentistry which are just making it easier to treat patients and making it a more efficient process.
It sounds like you came in at the perfect time with all these new techniques and processes and everything.
Luckily
Very
I
good.
did.
What is the process for treatments at the Palm Desert Center?
We have a unique process. Because we have 2 specialists in the office, I will see the patient and perform a comprehensive exam. We go through and I look at every single tooth in the mouth, see how healthy the teeth are, the oral structures are. We use x-rays to diagnose. We also can use CT scans, which will look at the teeth and the bones in 3 dimensions.
Dr. Nicholas says implants don't have to look like dentures. What's your thoughts?
Well, I think it's absolutely true. A denture doesn't have to look like a denture anymore. We have denture teeth that actually very closely mimic natural teeth. When you take these teeth and align them and try them in a patient's mouth, and this is what we do before the final restoration is processed, we can try it in wax and get an idea of how it looks within the frame of their smile. We can make the set of teeth look natural.
Do you enjoy what you do?
I really enjoy the art and science of dentistry. I think that's the reason why I became a dentist in the first place. I think it's why I became a prosthodontist, because we have the special ability to plan, design, and then fabricate the restorations ourselves. So there's a lot of creativity, There is science involved with it. The whole process and how it all comes together is what I enjoy the most, and really coming up with a nice solution for the patient.
What is prosthodontics?
Prosthodontics is one of the 9 dental specialties recognized by the American Dental Association. So like orthodontics, which deals with braces or moving teeth, prosthodontics deals with prosthetic dentistry.
How do you become a prosthodontist?
Well, prosthodontists will train for 3 additional years beyond dental school in a residency program, and so our study focuses on aesthetic dentistry, implant dentistry, crowns, bridges, dentures, and also full mouth restoration cases. So we study the bite, or as we call occlusion, and how it relates to the joints. I think one of the things that sets us apart is our ability to plan cases, and we also spend a lot of time designing and fabricating the restorations ourselves.
I understand that you are board certified.
Mm-hmm.
Okay, care to expound?
Well, board certification, just like a plastic surgeon becomes board certified or a cardiologist becomes board certified, prosthodontists can also become board certified in their specialty. And what it means is that you've achieved the highest level of expertise in the field.
What types of patients do you treat?
I treat a wide range of patients, mostly adults, but sometimes we treat children. Some children have some anomalies with their teeth that can be improved with prosthodontics, but most of the patients are patients who may just need a filling or a single crown, all the way to a patient who may need a complex restoration that involves all the teeth, where we may have to crown all the teeth or change the position of the bite. And also patients who have lost all their teeth, we make restorations that are supported on implants.
That's a lot of work. What is cosmetic dentistry?
Cosmetic dentistry refers to any dental treatment that enhances the teeth, the gums, and the smile.
What goes into the design of a smile?
Well, there's a lot of things that go into the design of a smile, and one of the first things that I look at is just the face, the position of the nose, position of the chin. I'm looking at where the patient's facial midline is, because I want to make sure that I create a dental midline which is coincident with the facial midline. That's one of the things I look for. The other thing is the level of the pupils. Are the pupils horizontal? Are the eyes horizontal? Because I want the plane of the bite to be horizontal to the patient's eyes. Then is the frame of the smile, and how high does the patient's upper lip move when they smile? How much gum do they show when they smile? Where is the position of the edge of the teeth when they smile? All those things I look at.
So what can you do about a gummy smile?
It really comes down to diagnosis. Sometimes it just is a little bit of removal of the gum tissue in order to lengthen the tooth, to make the tooth look more proportionate. That will correct the problem. Sometimes it could be a more complex problem where maybe it's the actual position of the whole upper jaw that is too far down into the patient's face, and when they smile they show too much gum. That's a more difficult problem, but it all comes down to diagnosis.
How do you avoid that big teeth look?
Well, it comes down to really studying the patient's smile. Every single tooth has a particular height and width dimension that needs to be followed with each tooth in order to make it look like it's in proportion with the rest of the smile. So if you follow those guidelines, then you'll be able to avoid that big toothy look. The other thing that we do is before we start treatment, we will perform a diagnostic wax-up on a cast to show the patient what their teeth are going to look like before we begin. The other thing we can do is when the treatment begins, we use temporary restorations on the teeth to mimic what the final restorations are going to look like. And then we can make any adjustments or changes depending on what the patient wants.
Okay. Another question that comes up is, how do you avoid the gray line that borders the crown?
A few years ago, crowns were generally made with their porcelain metal crowns, and they had a metal substructure underneath. And sometimes what happens is when a patient has one of these crowns in their mouth, the gum will tend to recede a little bit.
Okay.
And that metal line, that little border right at the neck of the tooth, can become exposed, and it will show a grayish line through the tissue. And so what we can do in order to correct that is either use a different material, such as an all ceramic material, which doesn't have any metal in it, which will then avoid the problem completely, or the metal ceramic crown can be designed in such a way to completely cover that metal border right at the neck of the tooth.
Who is a good candidate for veneers?
Any patient who is looking to improve the appearance of their teeth, who is looking to maybe fill in spaces between their teeth, patients who have some deep staining or discoloration of their teeth are good candidates for veneers. And also, you can make subtle changes in the shape of a tooth with a veneer if you have chipped or worn teeth.
How do you decide when to do a veneer versus a crown?
Well, a veneer is different from a crown. A crown is basically a restoration that covers the whole tooth.
Okay.
And so it's really designed to protect the tooth, whereas a veneer is more of like an elective procedure where the front surface of the tooth is removed, and a thin layer, an ultra-thin layer of porcelain is then bonded onto the surface of the tooth to mask any shades, discoloration, or to reshape the tooth.
Is it dangerous to grind down the tooth?
Not if you do it conservatively. Each material that we use to restore teeth has a certain thickness, and if you know the adequate thickness that you need for the restoration, such as a veneer or a crown, then that's the amount of tooth structure that you need to remove in order to fit the crown on the tooth and for it to look aesthetic.
Is this painful? I'm not sure listening to all this. I mean,
It's not painful at all. The patient is anesthetized, so each tooth is temporarily numb. And you may hear some noise, you may have some water, but other than that, you're not going to feel a thing.
that's good. How do you choose color?
Color is something that I work with the patient on. It's something that we closely determine together. I have a bunch of shade tabs that I use with different tooth shades on them that I present to the patient, and I sit with the patient and decide on what shade is most suitable to them. We can use very white shades, which we call bleach shades, or we can use a more natural shade, which exists in the more natural shade guides.
How do you stay on top of all the new techniques and materials?
It's almost impossible. It's extremely difficult. But during our residency training, we were taught how to evaluate and study the dental literature, and we studied the current literature. We also study the new dental materials that come out. We attend our continuing education courses, and we try to do as best we can to stay on top of it, because the industry is changing very rapidly, and new technologies and techniques they come out every day.
How important are the materials?
They're very important. There's many new materials that are out on the market. Most of these materials are very highly aesthetic. Precious metals are becoming very expensive, so the shift is starting to change into all ceramic materials. But it really depends on the patient. If a patient is a grinder or a clencher, then you want to use a material that's going to be very strong. You want to select something that's going to really withstand the test of time. Depending on what the patient presents, it's really important to select the right material for that patient.
Can any dentist treat a case like this?
Well, prosthodontists are the only dental specialists that are formally trained to treat these type of complex cases. In dental school, there's only a very limited amount of education that you receive on the bite, or what we call the occlusion. So a prosthodontist will train for an additional 3 years just in studying how to position the bite, exactly where the teeth need to be placed, so that you don't run into any problems with the muscles or with the joints. So all of this stuff is studied during our residency program, and if I was a patient looking for a dentist, I would want to be treated by a specialist. It's just like if I fractured my leg, I would want to be seen by an orthopedic surgeon. If I need a full mouth reconstruction, then I want to be seen by a prosthodontist.
What do you want people to know about you as a prosthodontist?
I think the most important thing, I want them to know that I'm honest, I want them to know that I'm caring. I want them to know that I'm straightforward, that I'm going to present them all the options and give them, discuss the risks and benefits of each procedure.
What are the common misconceptions about cosmetic dentistry?
Well, the first misconception is that cosmetic dentistry is not a specialty. It's not recognized by the American Dental Association. So most dentists are gonna tell you that they are cosmetic dentists. I mean, we all want to make teeth look nice. We want to make them look natural. So that's the first misconception. The second misconception is that cosmetic dentistry, such as veneers, they last forever, and that's false. Veneers, they can have problems. I mean, it depends on how well the work is performed. It depends on a lot of things. It depends on a lot of patient factors, whether or not a restoration is going to last. If a veneer is done very well, it's executed very well, then it can last up to 15 years. That's about the average length of time that it can last. But there's other factors that can cause it to break down. Dental decay underneath the veneer can cause it to fail. Wear, if a patient wears and grinds their teeth, it can chip or fracture the veneer. So there's other problems that can occur, and these things don't last forever.
How important is a dental lab?
A dental lab is pretty much just as important as the dentist that does the work. You need to have good, clear communication between the dentist and the ceramist who is going to be doing the work. They're the artists in this. They create and they're able to place those subtle characteristics in the teeth. So the dentist needs to be able to communicate those small details to the ceramist in order to create a natural looking tooth.
What are your final recommendations for patients who are considering dental implants?
Well, for denture wearers, for patients who might be considering dental implants to secure their dentures, give us a call and let us do a consultation and let us give you your options. We can improve your quality of life, and these are great treatments to help you function better, chew better, speak better, and just feel more secure. And also, the longer that you wait, potentially the more that your bone will shrink, and then it's more difficult to then place an implant. And if you wait too long, teeth can begin to shift, and then you may not have the space in order to place an implant. So those would be my recommendations.
This has been very informative. Thank you so much, Dr. Quiche.
Pleasure meeting.
Thank you.
Until next time. You want to go home? I just want to go home.